And of course you have the issues with overstretching, and we certainly see the impacts that that can have when you put too much strain on those muscles and tendons and the ligaments and the muscle imbalances that it creates because of it as well.
You know, it's interesting, actually, along those lines, and piggybacking on some of the things we spoke about earlier, about what types of new activities kind of emerged out of COVID and injury patterns. So Peloton, it was like this. It was like totally gripped the U.S. Peloton couldn't have been happier with COVID, and so I've had a lot of people come to me with a lot of like hip injuries, hip flexor injuries, psoas injuries, because they just jump on the bike. It's not quite fitted correctly. They've never really done it before. And they're not stretching either. They just hop on and they go. And so when I kind of push the patient on, like, did something happen? Was there something that occurred, an injury? No, I can't even think of anything. And then was there anything you started that you weren't doing before? Well, I got a Peloton, and I'm telling you, I've had, like, not kidding, like probably 10 patients over the last probably 3 weeks that have had the same story. Well, I did get a Peloton. I was like, yeah, okay. So tell me about that. How did you do? Were you cycling before? Did you ever do any spinning before that? No, I just wanted to do it. It was easy. You could order it. It comes to the house. Get an exercise program.
How interesting. And as I think through it, I mean, I can see why people think this, is that you get on a bike, you don't think of it as a motion that you should stretch before or afterwards, because you feel like you're going through a motion, so to speak.
A motion that's almost like stretching you out.
You feel like you're stretched out. Yeah. All right, well, all of those spinners out there and Peloton riders.
Be very careful.
Especially, I know there's a lot of middle-aged men out there who like to have competitions with each other and challenge each other.
You're like staring at me when you say that.
No, but there is. I don't know if you're one of them, but I do hear it from. I do hear, and you all like can compete against each other, and but if none of you are stretching at all, especially afterwards, you're going to end up. We should start calling it Peloton Hip.
Yeah, we should. That's catchy.
It is. Yeah. Peloton Hip. Maybe we'll put some stretches out after this about if you're on your Peloton and how to use your Peloton to do some basic stretches. Use your Peloton. There's some ways you can stand on it, stand around it, and use it to optimize that strength, especially in that psoas, those hip flexors. So I don't think people realize those are big muscles in there. They're strong muscles, but they attach to the front of your spine and can cause really major issues with your low back, hip if they're too tight.
And the number of revolutions that are occurring over the course of a 20, 30, 40-minute workout, it puts a lot of stress on that hip.
Better be using those glute muscles and doing some strengthening in those glutes to combat all of that.
Absolutely.
All right, I can't wait to put out this new series on the Peloton Hip. Thank you for that.
You're welcome.
All right.